Okay, let's take a look at the Renin-Angiotensin System, or RAS. This system is going to be involved with regulating blood pressure as well as blood volume, and the stimulus for the activation of this system will be low blood pressure. So the receptor for that low blood pressure will be the cells of the juxtaglomerular apparatus, or the JG. This is intimately associated with both the afferent and efferent arteriole of the glomerulus. The glomerulus is going to be found in the kidney, part of the filtration system for producing urine. So when these JG cells detect that low blood pressure, they release renin. So now we have renin present in the bloodstream. The liver simultaneously is going to be continuously releasing angiotensinogen. Renin will bind to angiotensinogen and catalyze the formation of angiotensin 1. This version is inactive. In order to convert into the active form, we need an enzyme called angiotensin converting enzyme, or ACE, that will convert angiotensin 1 into the active form, which is angiotensin 2. When this travels through the bloodstream and reaches the effector tissues, it's going to have a multitude of effects. So at the blood vessels, we're going to get vasoconstriction. So that's going to increase peripheral vascular resistance and also increase blood pressure. At the kidney, we're going to have a decrease in the glomerular filtration rate, or the GFR. And as a result of that, we're going to have a decrease in urine output. So that will also maintain water within the blood and make the blood pressure increase. And at the hypothalamus, we're going to have the stimulation of the thirst center. That will also be the impetus for increasing body water further. Inferior to the hypothalamus, we have the two portions of the pituitary, the anterior pituitary and the posterior pituitary. And from the posterior pituitary, we're going to get the release of one of the two hormones found here, which is antidiuretic hormone, or ADH. So something that is a diuretic makes you urinate, something like caffeine or alcohol, but antidiuretic hormone is going to do the opposite. It's going to maintain body water. So that will also help to facilitate an increase in blood volume and blood pressure. And then finally, at the adrenal cortex, so this is the suprarenal gland. There are the two components of the adrenal gland. There's the medulla that is located more centrally, and the cortex, which is like the bark of a tree, the outer layer of the adrenal gland. And that's going to release aldosterone. And that will also help to decrease urine output, increase body water, and bring blood pressure back up into its homeostatic range. So that is the renin-angiotensin system, or RAS.